Yeah, so thank you everybody. Such a important day for us. So they always say there is Vidyam Dadati Vinayam. Education leads to wisdom. Education is a single weapon which can create change in the mindset of millions of people and of course then make a world better place to live. So we are all here to know and to learn from each other. In the words of great Henry, from millions of years, it's told that anyone who stops learning, whatever its age is, either 20 or 80, is old. And whoever learns, whatever their age is, 20 or 80, they're still young, they're valuable, and they're productive to the society. So here I see a lot of young people, more than 170 young people here, collective together, who wants to seek knowledge, who wants to make world better place to live. Thank you each of you for dedicating your precious time on a Sunday morning and come here to learn from each other. So with that also, with folded hands and with flowers for each of you, I welcome wholeheartedly all of you here, all the delegates especially. And for today, even the nature is supporting us. There is not a single drop of rain today, so I'm so happy. The day started very well. And then I also always have high regards for the teachers whom have learned. So all salute to all the teachers here, what I have learned from, and all the seniors here. So the first lesson, what I learned from my legendary teachers is a tree which wants to touch the sky should extend its root down. So the more we want to go upward, we have to go more downwards. That means to say, we have to be down to earth, humble and grateful. Once we are like this, nature will take care of us and everything happens. And I also want to take the privilege to thank all the national faculty, Dr. Sonal, Dr. Nagori sir, Dr. Varsha Baste and Dr. Rajesh Kuradia, who have really taken all their precious Sunday. It's not so easy. I can understand their life, you know. Every Sunday, somewhere or the other, they have to run. Why are they doing all this? It is just to share their knowledge. We heard such a beautiful lecture from sir about male infertility. It was kind of even eye-opening for me. So it says that nobody can attend this, topmost of knowledge. We are in a curve. Something I know better, something sir know better, something so many people know better, and something you know better. The questions what you ask sometimes trigger a yes, we never thought of it. So thanks to our Society of Vizag Obstetric Gynec for giving us this opportunity to learn from each other. And then I would also like to thank Dr. Niharika. So we were thinking of hosting FERTYGNAN in Vizag. When we did this in Hyderabad, to our surprise, our management was like 250 are the delegates who will be most of the time on Sunday. But in my mind, I was thinking 600 should come and they should know what we are. So it was 594 delegates on Sunday from 8:30 in the morning, 5 p.m. in the evening were glued. We were so happy and we thought the same thing we will mimic in Vizag as well. Thank you, madam, for giving us this opportunity. And also, sir, Sita Rama Raju, sir. Sir, I know so much of work you have done in your field, but personally what I want to understand and talk about, sir, is when I see the discharge summary, you know, I just stop listening to everybody, I just go deep and see the discharge summary. Wonderful summary what you give to patients, sir. It is, even morning I was talking about it. This is something other than the academic, something you do to the patient. Thank you for that. Even we have learned many things, you know, to present the summary that way. And of course, Shashi Prabha madam. By just seeing her, she's so pleasant. She has done, I won't be reading the regular degrees, what they have. Everybody knows about her. But she is there even before the session started. Look at the timing, what they maintain. So we youngsters should pick up each point from seniors and learn our way forward. So one important thing, whatever said and done about her, I also want to use this platform to thank her daughter. I think everybody knows Sunkara. So I am a very fan of Sunkara. I really didn't know she was from Vizag. Always I was like, oh my God, there is one lady in our country who has gone outside the country and made us so proud. So for this I should thank madam. And always, you know, when our flag outside our country is taken, and it's something I always dream of. Yeah, this is what we should be proud of our country. So she has presented this beautiful research paper of 4 lakhs, more than 4 lakhs couples in the study, and it was a game changer for us in the fertility field. I think fertility experts here can connect with me. The number of oocytes required for a live birth, she has put it so well, and it was definitely a game changer in the field of fertility. And of course, we also invite Dr. Shilpa, who is an observer here. Thank you, madam, for coming here and giving honest opinion of what you are observing here. Thank you so much for taking all your time. So about Ferty9, just 2 minutes, bear with me. Ferty9 started as a small baby. We started 10 years back. We started our journey like a baby. We just started as a nursing home practice, nothing. We knew this art of fertility. We wanted to see how we can treat the patient. So the whole intention of starting of Ferty9 was service oriented, being transparent, and then ethical. These 3 were our basic root of starting Ferty9. And of course, when we started the journey, from elders from my house was just make a good name. Everything else will follow in life. Only remember, you should be called as a good doctor and a good human being. So journey started that way. And then this was our first center in Sikandrabad. And I am also a firm believer of Abdul Kalam ji. I respect him a lot. And at home, I am very proud. I have Abdul Kalam at home, my father-in-law. I learned so much from him. So this is what I always feel. When your intention is very pure and you know that you want to do some service, and any field, it may be a medical field or wherever you are, if there is some kind of service in whatever you do, and if you touch millions of heart, you don't have to run behind success. Nature comes in, it takes the cause, because God can't manifest everywhere, no? He'll be trying to choose the best. So through him, success is there already. So I believe in that. Somewhere, whatever you do extra mile and put little service in your practice. So nature is there to take care of rest. So now we are 10 years from then. We have 7 centers in AP and Telangana. We are very happy about it. And all this could be achieved with the help of my beautiful, wonderful team. We have 16 consultants with us. So journey started with only 2 doctors, me and one of my doctor as well. But now we are 16 doctors. So bird of same feather flock together. We are very happy about our consultants. Each of them came with good knowledge. Some of them got trained in our center. Some of them came with lot of training. And we are very particular. Every Wednesday we have an academic session with all the consultants. SOPs are driven very strongly. And what is the latest update practices and guidelines are followed in my center. And also at this point, I would outside for Hyderabad, there are good consultants. They follow the same practice. One example I can tell: when beta HCG comes negative for a patient after IVF, I have my consultants coming and sitting and crying in front of me. Why did it happen? Everything is fine, because we know even in unexplained infertility, everything is fine, still they fail. So I have to initially counsel. We don't know. So many things are not in our control. So in that way, I am very happy, thankful to all my consultants. They are take care of the patient, very holistically. And of course, we have a good embryology team as well, because training clinician was not as difficult as getting a embryologist. It was not so easy, because said and done, most of the things are controlled by embryologists. So thankful to our scientific director Charuji and her team for training and also getting the best in hands to maintain the international success rate. And then this is a beautiful video. I think you can't hear the voice, but I will just explain what's happening. This was a movie in, I think, good news. If you hear the voice, you can understand. The doctor calls fertility center. Most of them, what do they think? 2 couples are sitting there. You know what he is telling? I'm sorry, this is the first time this has happened in my life. What has happened? Then he says, there is some gamete mix-up. Means his sperm and his eggs are put to another lady, embryo transfer. This movie was such a disaster for fertility, I think all of you can echo my voice. After this movie, and it became a successful movie as well, because they know how to make it popular. I was seeing this movie and I knew the repercussion of it. The very next week, we got all patients. Madam, are you using my gametes? It was, I just don't go about movie and so many other movies like Vicky Donar, hundreds of kids he has. See, this is not we are made for. We are fertility experts. We do know, a patient sitting in ICU has so much of trauma, the relatives outside ICU. But end of the day, after 1 month or 2 months, he either comes out or whatever. In 1 year, they forget about it. But with the fertility, a lady sitting there in with you with the maternity, lot of pregnant women. I have seen in my own life, my own relative as well, the way she was before, so charming. She used to go out everywhere. But repeated in our country, it's always like that. How many years you're married? Then next question is, how many kids you have? It is so much tied up in our, so I also pledge and request all the gynecologists here, because you're seeing the number of fertility raising in our country. Prevention is better than cure. All my topics, I'll never end giving the importance of age. So all your ladies, your family, your friends, please give this importance of age. Whatever women empowerment, we all read, we all have, but end of the day, there is a window of fertility. She has to finish her fertility if she doesn't want to run around doctors before 30. In this, I always have great regards for my elders, my grandmothers, who are always telling, first you should finish fertility. You should have a baby. So 30 years is something which, at that point we don't know. Oh, we want to learn, we want to do PG, we want to go there. But what about this uterus starts aging? Ovary starts aging. So we need to, have a single voice, and prevention is better than cure. We don't want all patients coming to us and, breaking their, let them conceive naturally. That's the right of every couple also, to conceive naturally. So then we also very happy about our management, they are here and they have got a RI witness system in our all Ferty9 centers. What is this RI witness system? A human error of gamete mismatch, 100% it rules out. It rules out. It is a radio frequency tagged to the patient. How we get a barcode, no? All the dishes of the gametes are tagged 24 hours into 7 days into 365 days. So anything wrong, it pops out. Thank you. Thank you. Done. So we in Ferty9 have created more than 10,000 happy couples. Thanks for all my team. And then also we do a lot of training programs where more than 200 gynecologists have been trained for level 1 and some of them for level 2 clinic as well. Because we believe that in periphery there should be a satellite doctor who is expert, who can take care of patients there. Every patient from villages can't come to the city. So training is so important, at least level 1 clinic. So I'm very thankful to, especially Dr. Shravya. She has taken care of our academic wing very well. Thank you for that. And as a team, we are all there to go. So what I would also end is, we are what we do, repeatedly do. Excellence then become a habit. It's, it's an act, it's not a habit. So that's what we are here for. So now, Ferty9, after 10 years, it started like Madam was telling, you are the stem. I don't feel that. See, any tree or any institute which has to grow, it should be a teamwork. And when patient comes to us, 365 days we are not there. It's always better to train people and put the patients in safe hand. So we are very happy that we have all good consultants now. From STEM, slowly we have grown up and we have formed a good tree, a fruitful tree which wants to give fruits to a lot of childless couple. So from AP Telangana, I also thank my management who also have told that, see, when anybody from our states grow outside, we are very proud, like Sunkara madam. She has gone outside and she's making our country popular. So similar way from AP Telangana, even we need all your support and blessings. We want to continue the good work and we want to even go for Pan India. So we need all your support for that. Thank you so much.